Hello, and welcome to Hudson Health. My name is Stephen Rossman. I'm a board-certified orthopedic surgeon who subspecializes in adult reconstructive surgery. Now, what is adult reconstructive surgery? Well, in short, it encompasses joint replacements of the hip and knee. A little bit about myself. I'm originally from New York. I grew up in Rockland County, did my medical school out in Long Island at New York College of Osteopathic Medicine. Then I went down to Southern New Jersey for my orthopedic surgery residency at Rowan School of Osteopathic Medicine. Then I went out, they took the New Yorker out to Minneapolis, Minnesota, where I did a one-year fellowship where I specialized in hip and knee replacement and complex reconstructions of the hip and knee. First job out was back at Rutgers, New Jersey Medical School in Newark, where I took a job at Chief of Joint Replacement, where I worked for 3 years, along with the orthopedic surgery residencies. And then Hackensack stole me away, and I couldn't say no. And so now currently, for the past 2 years, I've been working at Palisades Medical Center and also up at Hackensack University Medical Center. My goals for today is to talk to you guys about hip and knee replacement, what it entails, who's a good candidate for it, what you can expect before and after surgery. And in addition, also, we have some very special guests from our physical therapy department who are going to talk about the new physical therapy outpatient center at Palisades Medical Center. So we'll see you right back for that after a short break.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name's Steve Rossman, total joint replacement orthopedic surgeon. Now we're going to get into the nitty-gritty of talking about joint replacement. Well, it's certainly a normal part of life to have aches and pains. Maybe you overdid it at the gym, or the weather's starting to get nice outside, you're going for a walk with your family, and you're starting to notice that you're having pain. Hip and knee pain that occurs with activity and improves with rest can be an early sign of arthritis and a reason to come into our office for an evaluation. Now, there are countless reasons for you to have joint pain, and far more than I can go into in this 30-minute program. What I'm going to focus on today is primary osteoarthritis of the hip and knee. So what can you expect when you come in? Well, typically, a surgeon is going to perform a detailed history and physical, as well as a basic x-ray of the body part in question. These x-rays can be done right on campus at Palisades Medical Center. And in fact, I'd recommend them because our radiology staff is specifically trained to obtain the appropriate x-rays that are necessary to give you a proper evaluation. Usually, the history and physical, as well as the x-rays, will allow me or any surgeon to make the diagnosis. And certainly, if further imaging is necessary, an MRI or something like that might be required. So what is arthritis? Well, the CDC defines it as an inflammation or swelling in one or more of the joints. And it can describe more than 100 conditions. But certainly here we're going to focus about specifically osteoarthritis. And osteoarthritis is really a mechanical issue. Think about it as a breakdown of the cartilage in your joint. I like to describe it to patients as the tire on your car. As the tire starts wearing down, that's the wear and tear on your joints as the cartilage starts wearing down as well. And typically, you may start having pain, swelling, and inflammation around the area. Here is a picture of a patient's hips without any arthritis. You can see the black space between the joints, very wide. And the next picture is a shot of bone-on-bone arthritis of the hip. You can imagine how much this hurts. The bone is literally grinding on itself. The next picture shows a knee, multiple views of the knee, And you can see the femur on the top, the tibia on the bottom, and the black space in between is the cartilage or the joint space. And again, in this next picture, when that wears down, that's what's considered arthritis. And you can have arthritis in multiple parts of the knee. So typically, you're going to come in, we'll get the x-ray, we define that you have arthritis. Well, now what do we do next? We're going to start with conservative treatment. Conservative treatment for osteoarthritis typically consists of anti-inflammatories, physical therapy, and weight loss, right? Less weight on your body is less weight on your joints. Once those fails, we go into a little bit more invasive procedures. Those basically entail steroid injections and viscosupplementation. Those are two types of injections that we can give into the knee to help decrease your inflammation and help control your pain. And when those fail, if you have severe bone-on-bone disease, we may consider you a candidate for hip or knee replacement. Now the question is going to be, who's a good candidate for surgery? Well, we've already discussed that we're going to go through all of the non-operative treatments that you can do. And after you failed all of those, of course, if you have bone-on-bone arthritis, we're going to consider you a candidate for surgery. But there's another thing I'd like to discuss here too, and that's proper patient selection. So in general, the complications are very low with surgery. But there are complications such as infection and wound complications. And in order to do that, that's where we focus on patient selection and preoperative optimization of your medical issues. For instance, if you're a diabetic, we want you to have well-controlled blood sugars. If you're a smoker, in general, I would say stop smoking because that is a high risk for infection. And also obesity or overweight. Patients who have increased weight also have an increased risk of complications. So you're a good candidate for surgery. Now what can you expect? Well, typically, the surgery takes about 2 hours, give or take. Then you're usually up and walking the same day with physical therapy. Patients are typically staying in the hospital overnight, and most of the patients are going home the following day. The days of going to rehab for weeks on end are really over. It's all about quick and rapid recovery and multimodal pain control. Now, what does that mean? We try to give you lots of different medicines that work on different pathways in your body to avoid narcotics. Narcotics make you sleepy, they make you constipated, and they're really not helpful to moving forward. After that, therapy usually comes to your house for a couple of sessions, and when you graduate that, you go to outpatient physical therapy for the rest of the time. Most patients are pretty much recovered by 4 to 6 weeks, but certainly some people can take up to 3 months to a year to completely recover from joint replacement surgery. When we return, we have 2 very special guests from our physical therapy department that we're going to talk about the new facility. So stick right there, we'll be right back. Welcome back to Hudson Health. I'm Steve Rossman, orthopedic surgeon and total joint replacement specialist at Palisades Medical Center. Right now we have something really special for you. I'm very excited to introduce Keri Borsella and Diane Matlick with the physical therapy department at Palisades Medical Center. How are you guys doing?
Excellent,
Good,
Dr. Rossman.
It looks like you got a really nice view behind you. That's New York City.
We do.
So you guys right now are in our new extended rehab facility service, right?
Correct. So our outpatient rehab, our outpatient rehab facilities have begun to consolidate into one beautiful location right here along the riverfront.
That's absolutely great. So what kind of services are offered in the new space?
So here within the 7,500 square foot facility, we have adult physical, occupational, and speech therapy services, in addition to a full line of pediatric specialized services in the same physical, occupational, and speech as well.
Now, is this in the same exact area where your guys' previous facility was?
Yes, actually, we are a half a block away from our old outpatient services, which was at 7,700 River Road. And our pediatrics used to be within the hospital. We decided to move everything out of the hospital and into this beautiful facility, state of the art. And now we are all under one roof to make it really easy and convenient for our community.
Well, that's great. How many different therapists and people did you have working there?
So we currently have 13 physical therapists. We have 4 occupational therapists, and we have 8 speech therapists.
And how many days a week do you guys operate out of there?
We are currently 5 days a week from 7 a.m. until 8 p.m. And we're going to be adding Saturdays very shortly to enjoy the summer view along the Hudson River.
Well, that's absolutely great. It's actually right down the hallway from my office, so that's a pretty good place to be.
Yes, we'll be neighbors.
Is there going to be a grand opening of this facility?
Yes, we are actually in the planning of it. We are assuming that we go well with everything and the opening should be within the next couple of weeks. Our grand opening should be right before the end of May. So we're very much looking forward to it, and for you attending as well.
Oh, thank you very much. I look forward to being there. So I want to talk a little bit about specifically hip and knee replacement and how that entails what goes on over there and what you guys can offer for it. So
Diane Matlick, our rehab manager, she'll be addressing all of our clinical programs here.
Perfect.
Hi, I'm Diane Matlick, and I'm the manager of rehab services here. I don't know. Want to answer a question? Oh, are you going to ask a question? What kind of services?
We offer, no, you just answered that.
Well, specific to orthopedics, specific to,
Yeah.
Okay.
So we offer physical therapy, occupational therapy, speech therapy. We also offer physical therapy for all sorts of diagnoses, whether it be sports related, orthopedic, neurological, vestibular, if you have a dizziness issue, therapy for balance issues, anything.
Well, that's great. As far as focusing on, let's just say, post-operative care for taking care of hip and knee arthroplasty patients, how often would you typically recommend seeing them after the surgery?
Typically for a knee, we would see them 2 or 3 times a week. Hips usually are okay with just twice a week.
Another question I have, that patients are usually concerned about how difficult and painful therapy might be after joint replacement surgery. Can you speak at all to that?
Yeah, that's definitely a valid concern. Knee replacement is probably a little bit more difficult than the hip replacement. You have to get the range of motion back in the knee, and the knee tends to stiffen up after surgery, so that can be a little bit of a challenge. But with proper medication and us working with the patients, we can accomplish that with minimal pain. Hip replacements, usually there's minimal pain after surgery.
That's great. And then can you speak a little bit to what you guys are doing in the facility as far as patient safety? Obviously, with the current COVID pandemic, people really wanted to do therapy at home, and now people are starting to get a lot more comfortable leaving their house and going out to the facilities where you have a lot more equipment that you can do with.
One thing that's nice is we're doing one-on-one care here, so we only have one patient with each therapist at a time. We screen everybody before they come in, several times actually. We take their temperature before they come in. We wear masks, we wear face shields or goggles, and the patients are required to wear masks the entire time as well.
Well, that's great. I think I've certainly noticed over these past couple of months that patients have felt a lot more comfortable starting to leave their homes. Well, I appreciate your time. We're going to go for a quick break, and we'll be right back.
Thank you very much.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, Retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Good Friend Self Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self Storage. Let us be your good friend.
Welcome back to Hudson Health. Steve Rossman, orthopedic surgery, total joint replacement. I'm joined by Keri Borsella Diane Matlick from the physical therapy department. And we're back to talk a little bit more about the physical therapy that goes on before and after joint replacement. So Diane, I wanted to ask you, what does entail? I see a patient that has, let's just say, osteoarthritis of the knee, maybe some weakness and some stiffness. I want them to undergo joint replacement, but I want to send them to physical therapy first to help decrease their pain and make them a better candidate for surgery. So what are things that the patient can expect when they see you for the first time?
Yeah, I think it's always a great idea because we do so much education so we can explain to them what they're going to expect before and after the surgery. We can maximize the range of motion that they have because the more they have before the surgery, usually the better they do after. We can work on strengthening. Balance is huge. A lot of times their balance is affected by the joint not working properly. So we want to make sure they have the best balance possible and the best gait possible so they walk as normally as possible and so they do the best that they can afterwards.
Are you looking for certain things or milestones for them to accomplish preoperatively when you say you've gone as far as you can go and we're now ready to move forward?
Yeah, I mean, there's not too much that we can do for them because obviously they're really in bad shape at that point. So we kind of keep it to a minimum amount of sessions. When they're independent in what we want them to be doing, that's usually when we can discharge them.
Yeah, I think that's a good point. A lot of times I'm seeing patients that either I sent to therapy or they've gone before they've seen me, and therapy sometimes makes it a little bit worse because it's hard enough for them to move around as it is. So I think that's it. Now they've gone through the preoperative stuff. We've done their surgery on them, right? And now I tell my patients, we're going to put you to work. So the day of surgery, you guys are actually seeing them in the hospital, right?
Right. So our team is ready and we work very closely, obviously, with Dr. Rossman, our orthopedic staff. So on the day of surgery, as soon as they come out of surgery and they're through recovery safely and comfortably, once they get up onto the floors, first thing is up and out of bed. So there's no rest for the weary, but the importance of being able to mobilize as soon as you're waking up and really kind of starting that recovery process is create that sense of, I can do this. I have confidence in the new joint and it's going to work well. Getting you up, mobilizing, it makes you feel better. It helps actually to reduce pain, and it gets you back on the path to better outcomes. So you quickly begin to have less pain, begin to walk more normally, and start to get your range of motion and your strength back. So, and we are there to be your biggest fans, your biggest cheerleaders, and your biggest supporters, but also to guide and to educate you. So we do work with them quite a few times before you're ready to leave the hospital to make sure that you're ready to go home and you're going home safely, whether you have stairs or if you're on a one floor, it doesn't matter. We make sure we cater to what you need so that you're going home safely at that point.
That's right. Typically, they're getting up the same day as surgery. The following day, you're usually getting them up in the morning and the afternoon, potentially before they go home, right?
Yeah.
What would what would you say to patients who may get discouraged that maybe they're not moving as quickly as they expected to move in the hospital post-operatively?
I mean, everybody's different, and we try to explain that to all our patients, no matter what they're coming in for. They have these expectations. Maybe it's realistic, maybe it's not, but everybody's different. Everybody responds differently to surgeries, whether it be the anesthesia or the procedure itself. So there's no set in stone path. Everybody has their own path.
But our job is really to make sure that we're bringing them forward as much as they can, but again, within their tolerance and within what they're able to do at that time. So that's really where the skill and the education of the therapist is important, because we're able to identify at what pace they can move forward safely.
Great, thanks. So now we've finished therapy in the hospital, the patient goes home. Now the home care is set up and they're going to have a couple of sessions at home, but now they've finished that and they're ready to come to you guys to really start getting their recovery process going on. Take us through a little bit about what goes through the first time that patient comes back post-operatively to see you.
So we're going to put them through an evaluation first, because we need to see where they are. We're going to check their range of motion, their strength, their balance, look at their walking pattern. First day, we're already getting them moving. They might even be on the bicycle a little bit already. We're certainly trying to get range of motion in that knee. We're teaching them their home exercise program, educating them, answering any of their questions, trying to allay their fears a little bit if we can. But they are definitely getting moving that first session.
Well, that's great. I can't wait to see the new facility when it's all set. Keri and Diane, I greatly thank you for being here with us today, talking to us about knee and hip replacements, about the new facility. It's all very exciting. We're going to take a quick break, and when we return, we're going to talk about total knee and hip replacements some more.
Pen & Pencil Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at penandpencilproperties.com. Pen & Pencil Properties, building Jersey City for everyone.
At Hudson Regional Hospital, we promise to be prepared for your emergency.
We promise to provide world-class robotic surgical care.
We promise to treat you like family.
To provide accurate diagnostic care.
To provide the most innovative orthopedic care at your doorsteps.
We promise to treat your baby like our own.
To never stop investing in the best of spinal care.
To be with you every step of the way.
Here at Hudson Regional Hospital, we promise to take care of our community.
Welcome back to Hudson Health. Steve Rossman here again, orthopedic surgeon and total joint replacement specialist at Palisades Medical Center. Now I want to talk to you a little bit about what a hip and knee replacement entails. So first, starting with the knee. In general, we make an incision along the front of the knee. We move the kneecap off to the side. Now we're going to take this off here. Good. So I like to think of a knee replacement as putting a cap on the end of a tooth. And we're not really removing the knee itself, we're removing just a small piece of bone. So if you can see on the side portion, and this is where the cap on the end of the tooth comes, we take about a centimeter cut with various jigs that we have just to remove the arthritic part of the joint. We have a metal implant, and that's usually made out of cobalt chromium, and we can attach that to the bone either with cement or some sort of press fit type of thing where the bone will grow into that over time. And then on the tibia, we take about a centimeter of bone to freshen that off, take off all of the arthritis and the excess cartilage, and we have a metal implant and a piece of plastic that snaps into that, and usually we cement that into place, okay? And it is immediately stable once that cement cures. And then we close everything up and have you up and on your way, okay? Now that's pretty much a knee replacement. Like I said, a cap on the end of the tooth. Now we're going to move to hip replacement. So here's a basic hip replacement. Now a little bit about hip replacement. There are multiple approaches to the hip. They all have their positives and their negatives. You may hear about the anterior approach, the lateral approach, the posterior approach. And I always think the most important thing is go with the surgeon that you trust the most, that you have a good relationship with, and trust them to do what's best in their hands, as opposed to going in and saying, I want the posterior approach because I hear that's the best. Go with the working relationship with the surgeon that you trust and trust them to do what's best for you. So in general, when I perform a hip replacement, in general, I perform the posterior approach. And again, that's usually an incision that's along the side of the hip. And we go down and we take out the capsule of the hip. And here's the bone of the femur. Okay, so I'm going to show this out here. So normally the bone has a little bit of the head on the knees. If you remember those pictures that we showed you before, the femur is like a ball and socket joint. So what we do is we actually cut the head out, okay? That's where all of the arthritis is. Now, your femur bone is a hollow tube, okay? And everybody has different sizes, so there's typically 20 plus different sizes that we have. The femoral stem is typically made out of titanium. It usually has a roughened surface that the bone really likes and grows into. And we have various instruments that we use to prepare the inside of the femoral canal so that we can put the implant on the inside. And friction holds it in place initially, and then the bone grows into it over time. On the end of that typically goes a ball. That can be made out of metal or ceramic. And we put that on the end of it, and that stays there. If we go inside the acetabulum, or the cup part, okay, we typically have a titanium implant. And if you can see, it has a very roughened surface too, just like that femoral stem. The bone likes this, and it grows in there over time. Sometimes your surgeon may choose to put some screws through the cup to hold it in place. It's not necessary, and you don't even feel it, but they're there to hold it in place. And then we have a piece of very wear-resistant plastic that goes and snaps into there. And this is like the treads on the tire of your car, as I told you before. So this is a new tire on your car. So where you used to have cartilage on cartilage or ceramic or bone on bone once you have arthritis, then you have a ceramic ball on plastic, or in this case. And that's basically what's involved in a hip replacement. Most patients get put on 4 weeks of some sort of blood thinner. Typically, it might be a full dose aspirin. Patients are generally given 24 hours of antibiotics, and then they're finished. And at that point in time, it is over. And we're going to go to a quick commercial break, and we'll be right back.
A brand new truck isn't just a brand new truck when it's tough enough to have best-in-class available payload and smart enough to know that a cab can also be an office. A truck equipped with best-in-class available towing that asks, why can't all that power more than just this truck? No, your brand new truck isn't just a brand new truck when it's the all-new F-150. Tough this smart can only be called F-150.
Thank you for joining us at Hudson Health. I'd like to thank my special guests tonight, Keri Borsella and Diane Matlick, for being with us, taking time out of their schedule to talk to us about the new physical therapy department. Very exciting news at Palisades Medical Center. My name's Steve Rossman, again, orthopedic surgeon with subspecialty in total joint replacement of the hip and knee. Certainly, if you have concerns or worries about pain in your hips and your knees, where now is a safe time to leave the house and come to get seen by us. You can see my number right below if you want to get a hold of us. We're open 24/7. There's always a doctor on call, so if you need us to see you, we'll look forward to see you. Thank you very much for spending your time, and take care.